Voluma is a cousin of Juvederm. It is a hyaluronic acid, so it's a natural building block of the cells of our body. But this product has been designed a little bit different to be a little stronger, a little firmer, give more of a lift or a boost to the areas, and be a little longer lasting, so the body breaks this down a little bit slower than the other filler products that we have. It also has the XC, so it does have numbing medicine in there to make it more comfortable. And the other thing that's unique about this product is it was studied for volume replacement in the cheek. And that's part of the process of the aging or the maturing process. We lose elasticity of the skin, which is part of the problem, but we also lose volume. We lose bone, we lose muscle, we lose fat where we want it, we gain it where we don't want it. So if we look at the progression here, this young lady has this nice outward curve, and then it hollows and comes to an inward curve. So this is what we associate with a youthful proportion, a youthful balance. If we look at this progression, we see that this curve starts to flatten and lessen. And in this case, the cheek is really hollowed. It's become very flat in those areas. So that's part of the maturing process. And now we have a product that was officially studied for this area to help lift and boost and get it closer back to this area. So Voluma, once again, a hyaluronic acid. It is a long-lasting product. And these patients here, they were tracked out to the 2-year time period. And we can see that it was a very high number. Out even to 2 years, there's 67% of the people that still felt like they had filler product that remained, that they weren't back to where they started. Even though they're 2 years older, they're still doing well and still maintaining their results. The other question is how much filler product do we need? And this is a question that's really on an individual, determined on an individual basis, an individual consultation. You know, if we looked at these patients here, 4 different patients, some deeper, some not as deep. And we can see that with one syringe, everyone's better, and someone that's not as deep, it made a nice difference. In the patients that are deeper, it didn't do much. So we can see that we need more. So same thing with the patients that we looked at earlier here. You know, if someone comes in at this point, they're going to need less product to get this boosted up than someone that comes back at this level here. So Voluma, very unique that it's mid-face or the cheek volume replacement. Very soft, very smooth, very natural, and very comfortable treatment. We're very excited to have this, and our patients so far love it.